Hi, you guys. Welcome back for our daily practice questions. It is day 175 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. Also, my website is linked in the description as well. All right, you guys, question number one. A 40-year-old patient complains of shoulder pain worsened by overhead movement. Neer and Hawkins tests are positive. What is the first line treatment? Is it A, corticosteroid injection? Is it B, immediate surgical decompression? Is it C, physical therapy, activity modification, and NSAIDs? Or is it D, immobilization in a sling for 6 weeks? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the first line treatment? I tell you, if we're looking for a treatment, look and see if they have provided you with a diagnosis. And if they have not, you got to run it back and look at those assessment findings. So there's not a diagnosis provided. So let's see what's going on. The patient complains of shoulder pain worsened by overhead movement, and the Neer and Hawkins tests are positive. This is confirmatory of a shoulder impingement. So what you want to do is see physical therapy, activity modification, and NSAIDs. Question number two. After 6 weeks of physical therapy and NSAIDs, a patient still has pain from shoulder impingement. What is the next step? Is it A, to add acetaminophen daily? Is it B, corticosteroid injections? Is it C, repeat x-ray? Or is it D, order MRI of the lumbar spine? Take a moment and tell me what you got. All right, so stem of the question here states, what is the next step? Again, we know that there's a diagnosis provided when they typically are asking you for a next step, because that means that we have already done something to go to the next thing, right? So it does, and it shows us that the patient has shoulder impingement, and they've done the conservative route of physical therapy and NSAIDs for 6 weeks with no improvement, right? So next we got to bump up the stages of treatment. So B is your best answer. If the conservative route is not working, now we need to go to corticosteroid injections, okay? All right, lastly, question number three. A patient with shoulder impingement fails conservative therapy and multiple steroid injections over 6 months. What is the appropriate next step? Is it A, to start oral prednisone? Is it B, to prescribe opioids? Is it C, to refer for ortho-surgical eval? Or is it D, to begin systemic corticosteroids? Take a moment and tell me what you got, y'all. All right, and stem of the question here states, what is the appropriate next step? Again, when they say next step, they typically have given us that diagnosis because we are talking about what to do after something we have already done, right? So this patient does have shoulder impingement. He's had, or they have had, conservative therapy as well as multiple steroid injections with no improvement over a 6 month period. So your next thing would be C, to refer them to ortho for surgical eval, right? Remember to walk your way through, and that's primarily how all musculoskeletal injuries go. We're going to go conservative first, least invasive, least expensive, right? So we start with conservative management, giving those NSAIDs to reduce inflammation and to aid with pain relief. We rest it, we brace it, we do physical therapy, we splint it, whatever for the particular area that is injured. If that doesn't work, corticosteroid injections. maybe utilized to help aid more direct and localized for the inflammatory issue. And if those things also don't work, then we need to refer out and let ortho provide surgical management, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can shoot a text message to this number as well, or shoot an email to the nursing studio, the number one at gmail.com. Everything that I offer is linked in the bio of this page. But if you go to the first thing that has my website, as well as my website is linked in the description, you're able to access all of my resources broken down for whatever your scenario is and where you are with planning your studying. Okay. All right, you guys. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.